But in addition to that, if you truly want to be a leading center, it's not just enough to provide patient care. You also have to think about your workforce needs for the future. Many of the issues that we run into internationally are lack of workforce, lack of staff, lack of training. And those are things that have to be addressed and assessed. Oftentimes, I would argue those things should come first. And then you also have to think about the unmet needs of the patient. Because even if you create perfect protocols for medicine today, remember, the size of the medical literature doubles every 90 days now. It used to be every 10 years, every 5 years, then every 3 years, every 2 years, every 1 year. At this point, the size of the medical literature is doubling every 90 days.
Welcome to webisode 5 in this 6-part series. In the earlier episodes, we've discussed digital health, the use of data, investing in Africa, and global health professional shortages. Today, we're going to talk about systems. One of the major issues we face in the health sector is silos. There are too many, and they don't necessarily talk to one another. Unfortunately, we globally witness this lack of system thinking within both public and private settings. From my perspective, silos equals inefficiency. So system thinking, when set up correctly, can align people, process, and technology, which ideally improves value and patient outcomes. Today, we're going to focus on private health systems, and one in particular, Mayo Clinic and Mayo Clinic International. So just let me quickly set the scene when it comes to Mayo Clinic. So Mayo Clinic is a non-profit. It's an integrated health system committed to excellence in clinical practice, education, and research, and also guided by the primary value to always put the needs of the patient first, but looking at it from a system perspective. So Mayo now sees 1.2 million patients from 140 countries across the world each year. It has 70,000 employees and 5,000 physicians and scientists. And while Mayo Clinic has always been a global institution, over the last several years, the organization has worked to build a more thoughtful global presence. And today, Mayo Clinic has partnerships and offices located in strategic markets throughout the world. So, for example, it has destination medical centers in Minnesota, Arizona, and Florida, but it also has a Mayo Healthcare Clinic in London. It has a joint venture in Abu Dhabi, and it has 9 different care network partnerships in areas including China, Mexico, and in India. With medicine constantly evolving and the needs of patients changing so rapidly, Mayo is focused on sustaining and building the highest level of quality for the next 155 years. So the team that supports Mayo Clinic's international activities, they understand that the challenges of today's healthcare environment provide an unprecedented opportunity and responsibility to ensure Mayo Clinic's unique model of care thrives and benefits patients now and for the generations to come. And they strongly believe that a big part of that answer lies in creating this integrated global healthcare network that elevates care locally, especially for those with serious and complex diseases. So you see from my introduction and the way Mayo operates, there's a lot of system thinking that goes into that model. And we're going to explore that as we go through this webisode today. I would like to welcome our 2 guests today. I hope my summary of their bios accurately captures everything. Dr. Stacey Rizza is the Executive Medical Director for International Practice and Chief Medical Officer, Asia Pacific at Mayo Clinic. She is an infectious disease physician at Mayo Clinic in Rochester, Minnesota. Dr. Rizza has been involved in laboratory-based research, clinical research, educational initiatives, and has maintained a busy clinical practice. She is a professor of medicine and previous chair of the Mayo HIV Clinic and associate dean of the Mayo Clinic School of Health Sciences. Dr. Rizza served as the president of the Mayo Clinic staff and previous associate director for diversity and inclusion, Mayo Clinic Transplant Center. Dr. Mohammed Biden, MD, is a professor of neurosurgery, orthopedic surgery, and health services research at Mayo Clinic, again in Rochester, Minnesota. Dr. Biden has clinical expertise in the areas of complex spine surgery, spinal oncology, and minimally invasive spine surgery. At Mayo Clinic, Dr. Biden carries a busy surgical practice and has received honors for his exceptional delivery of patient care. He serves as Executive Medical Director for Mayo Clinic International and is Assistant Dean of Education in the Mayo Clinic College of Medicine and Science and Medical Director of the Mayo Clinic Enterprise Registry, a real-time patient safety and outcome platform that integrates data from Mayo Clinic's hospitals in the US. Welcome. So I want to jump straight in with the questions and the discussion. Mayo is a huge organization. It takes a lot of organization and structure and people process alignment to create this large scale initiatives. But maybe we can start by looking at Mayo internationally and talk about that. So Dr. Rizza, what are Mayo Clinic's goals internationally? Thank you.
Well, thank you, Charles, for having myself, Dr. Biden, here today. We're honored to be a part of this discussion because, as you mentioned, Mayo sees itself as a strong part of integrated health, taking care of patients and elevating patients internationally. So just to take a step back for a second, Mayo Clinic's vision for the next 10 years, our strategy for the next 10 years, is to cure, connect, and transform healthcare. And in order to do that, it must touch all of humanity, not just our local areas in the United States. So Mayo Clinic International is a pivotal part of that vision to cure, connect, and transform healthcare. And we do that with the goal of elevating care locally for patients, with a special focus on patients who have serious and complex conditions. And we're doing that through an international healthcare network that'll be focused in target markets. Now, when I say we're going to cure, connect, and transform Mayo as a whole, for international, that means we plan to help cure by providing for the needs of the patients in these international markets, and also educating future healthcare workers to continue to drive global research opportunities and touch patients through education and research in as many places as we can globally. We're also helping to connect by simplifying access to definitive answers for patients through engaging them with digital health and digital means that they can connect on these international sites. They can stay in market, but still connect to outstanding healthcare internationally. And we're transforming internationally by sharing our knowledge to elevate and change how care is delivered in these international markets. But as you mentioned earlier about Mayo, above all, we put the care of the patient at the center of our strategy. And our goal is to elevate the care locally and make it simpler to access Mayo's resources and provide patients with answers wherever they are. And I'd invite my colleague, Dr. Biden, to add anything else when looking at Mayo internationally as part of Mayo's 2030 vision.
I would agree wholeheartedly with everything that Dr. Rizza has said. It's very important to Mayo. Mayo's always taken care of many international patients from all over the world, 140 countries, nearly every country represented. Mayo understands that we cannot possibly take care of every patient in our destination campuses in Rochester, Minnesota, Phoenix, Arizona, Scottsdale, Arizona, or Jacksonville, Florida. So we would like to take Mayo to the world in some ways. And that's why we have our outpatient facility in London. That's why we have our joint venture in UAE. and more potential opportunities that will be emerging for Mayo. And as Dr. Rizza indicates, there's many areas that Mayo can engage with a patient, and a patient can engage with Mayo expertise, including just by using the website, gaining information, learning. There's often local affiliate hospitals in multiple cities throughout the world. And so Mayo will expand globally and internationally, and that expansion will continue over the coming 10 years. And it'll be exciting to see a healthcare brand like Mayo expanding internationally.
Thank you very much. And I keep looking down because I'm writing notes as you talk. So I really like the comment there about your cure, connect, and transform. And I think that can be applied in many settings and has relevance for many out there. Also, the complex, the building the network, and the education. So again, you're touching on what I call the building blocks, and it touches on that. I think the comment I made right at the beginning, that quite often in health systems, it's very siloed, and that if you put the right building blocks in, you can achieve what you want to do. And that in particular is putting the patient first, then allowing that coordination of care to be appropriately done. And that geographical boundaries aside, you can do that if you've got the right building blocks in place. So Dr. Biden, let's now, I'll ask you this question. How do you ensure Mayo's culture, values, and consistency of clinical practice are retained and maintained when entering the new markets? Thank you.
Yeah, it's a great question, Charles. Thank you. And thanks for having us today. So Mayo's culture is the most important thing to Mayo Clinic. It's a unique culture. This culture is built and predicated upon the needs of the patient come first. When you look at Mayo, we have three shields. We have clinical care practice in the middle, and we have two other shields, which are research and education. All three shields work together for the benefit of the patient. Within our practice, the needs of the patient come first. Our research shield is built around the unmet needs of the patient, understanding that even for serious and complex conditions, many of them have no cure, many of them have no treatment, and it's up to Mayo Clinic to help define, delineate, and expand the options for those patients. And then in the education shield, this is Mayo's workforce of the future to take care of our patients. So all three of those shields work closely together as a part of Mayo Clinic. Mayo Clinic's culture is unique, and any patient who steps upon any of our campuses, whether in Minnesota, Florida, Arizona, or elsewhere, will notice a significant and unique Mayo flavor and culture to being on that campus. Many places talk about being patient-driven. Mayo is patient-driven at its core. The care is not incentivized. The leadership is rotating. The system of care is consensus-driven and consensus-built. It's unified care and it's organized care. We have oncology protocols that are unified across the house of Mayo Clinic. So regardless of which specific consultant you see, you're going to be given the same protocol. So it's not a consultant-driven protocol, it's a institutional-driven protocol for the benefits of the patients. Mayo is great in a variety of different specialties. We don't say come to Mayo for one specialty or that specialty. The specialness of Mayo Clinic is the breadth of greatness. So regardless of which specialty you're seeking Mayo in, you're going to be able to find great worldwide expertise within that specialty. And at Mayo Clinic, we really take care of everybody. And so we have patients from all walks of life, all countries, all 50 US states, and we take care of everybody equally. And we give everybody the best care, just as we would give that to our family members. We also have high volume care, and we have conservative indications. There's many patients who come to us who have been told that they should undergo a certain treatment or a certain therapy, and we refine, change, or radically alter that treatment plan. It's a unique place, it's a patient-centered place, and the culture of it is very strong and embodies all 70,000 employees rowing in the same direction. Dr. Rizza has been a leader at Mayo Clinic for a long time, and if you have anything to add regarding that, please, Dr. Rizza.
Very well said, Dr. Biden. And having lived and worked at Mayo for a long time, I agree with every word he said. The only thing I would add is that Mayo is driven by its mission and its values. We have a number of values that we actually spell out the letters. The first letter of each value spells out rich ties. And the T in that is teamwork, and it involves innovation, many other compassion, many other parts of our values. But I think teamwork resonates through every inch of Mayo anywhere in the world. And it's part of how we serve the patient better, but it's also part of how we break down those silos that you mentioned, Charles. So Dr. Biden mentioned how many specialties we have, how many teams, how many areas. And what's beautiful about Mayo is I am an infectious disease doctor. Dr. Biden's a neurosurgeon. If he has a patient with a neurosurgical infection, he gets on the phone and he calls me. This happens all day long, every day throughout Mayo. So every patient isn't seeing one patient, one physician here, one physician there, trying to translate their own care. Mayo functions and works as a team, whether you're seen in London, whether you're seen in Minnesota, whether you're seen in Abu Dhabi. And we call each other across the enterprise, and every patient gets the benefit of that team approach and the best care in every specialty. And that's part of what makes Mayo so special, but also efficient and sometimes able to make the diagnosis a little better because we work together across different silos.
No, absolutely. And the way you're explaining it, there are so many good lessons from this to be shared with others. I mean, the ingrained culture, the ingrained values, and the importance of teamwork. And unfortunately, we see in many of the markets that we look at that this teamwork isn't always necessarily there. And that's understandable at times because of the lack of healthcare professionals. But if you're able to create that teamwork around the clinical care, also link it to the research and the education, ultimately down the line, it's the patient that actually benefits. And I also like the comment, the no care incentivization. And again, I think there's lots of lessons to be shared in many markets for that as well. And that consensus driven care leads to that sort of multidisciplinary working, if I can call it that, and the sort of the standardization of protocols. And again, ultimately, that benefits the patient. So thank you very much for that. Dr. Biden, the next question is, how does Mayo Clinic effectively create these ecosystems across the globe? Thank you.
So the Mayo ecosystem is a difficult thing to export and a difficult thing to recreate. Having said that, we have often not succeeded when we just take a single part of Mayo somewhere. And so we've received many requests. We want to create a great medical center. We want it to be like Mayo. And when we receive those requests, we really have to think very hard about what that means to make a center like Mayo. And one of the things that we've decided is that as we build that Mayo ecosystem, there's many aspects to it. There's a patient experience aspect. There's a multidisciplinary aspect. There's an aspect of the consulting staff and allied health staff. There's aspects of non-incentivization. There's many different facets that go into that. But one of the facets that we have to evaluate is our three-shield integrated model. And so a major part of it will be that when we talk about helping an organization, a government, a country, a hospital system, recreate a great center, there's all the things that you've heard about today: serious and complex care, integrated care, multidisciplinary care. But in addition to that, if you truly want to be a leading center, it's not just enough to provide patient care. You also have to think about your workforce needs for the future. Many of the issues that we run into internationally are lack of workforce, lack of staff, lack of training. And those are things that have to be addressed and assessed. Oftentimes, I would argue those things should come first. And then you also have to think about the unmet needs of the patient. Because even if you create perfect protocols for medicine today, remember, the size of the medical literature doubles every 90 days now. It used to be every 10 years, every 5 years, then every 3 years, every 2 years, every 1 year. At this point, the size of the medical literature is doubling every 90 days. So there's a lot of unmet needs. Things are rapidly changing in medicine. And so you have to have robust research, education, and practice to create a vibrant, unique ecosystem. In addition, at Mayo Clinic, we have consensus-driven advancement and consensus-driven growth. And what that means is everybody gets a voice, everybody gets a seat at the table. It's rotating leadership. It's not, one person sort of rule for X number of years, and then the next person comes up. It doesn't work that way. It's rotating leadership, and that's by design. And that's been there for this very reason, and it's worked well for a long time, for 150 years for Mayo Clinic.
Okay, thank you very much, Dr. Rizzo. I don't know if there's anything you want to add to that.
I just want to emphasize a point that Dr. Biden made, just to look at it from another perspective, is the ecosystem shows that even patient care, education, and research are not three separate entities. They actually do blend into a single force that's taking care of the patient. As Dr. Biden said, research is to find cures for the patient. Education is to provide healthcare workers for the patient. And all of that is to drive patient care forward. So even the silos that we sometimes think about between academic pursuits within medicine are part of what Mayo is blending into these ecosystems to really give what we consider the best care for every patient.
Okay, thank you, Dona. Thank you very much. And again, you're touching on so many themes and issues that we, from an IFC perspective, when we're looking to make investments into the markets that we look at, we're touching on those issues, that the healthcare professionals aligning the dots, if I can call it that, from a knowledge perspective, making sure that best clinical practice can be delivered, and it's not just a theoretical aspiration. And I like the sort of I was thinking here about cut and paste is hard. So when you want to go into new markets, you've really got to do your sort of be careful evaluation. You want to build that commonality of understanding. And again, you've emphasized it's not just the patient care, it's the workforce around that patient, and it's the training and the education, and then keeping on top of the knowledge and being able to share that knowledge as well. And again, I think with the whole digitization of health, that's going to help fast track as well this knowledge share. So Dr. Rizza, it's not always easy. So what are the biggest challenges and also opportunities as it relates to creating affordable, sustainable healthcare system? Thank you.
That, a loaded question, but a very good question, Charles. Thank you. There are a number of challenges, but I believe, and at Mayo, we believe every one of those challenges becomes an opportunity. So maybe what I'll do first is just step through the challenges that healthcare in general across the world are going to be dealing with in the next 5 to 10 years. And then we can talk about ways that healthcare entities and enterprises can help drive it forward as an opportunity. So there are definitely behavior shifts that are occurring in medicine. When the old days, all medicine was delivered in person, everybody went and visited their doctor, or inpatient. If there were any procedures, they'd be put into the hospital for that procedure. And we know that that is shifting to more care being delivered at home and more care being delivered digitally. And with that, there's more commercialization that's driving demand and convenience for how patients want to seek their medical care. That also brings up the issue of privacy and personalization of care, precision medicine, where the care I get with one disease may be slightly different than the care somebody else gets with the same disease. And then affordability on how we make that work. The other thing we're noticing is a shift from caring for the sick to maintaining the healthy. So a focus on wellness and prevention rather than just waiting for people to get diseases and treat them. There are also a number of policy and reimbursement reforms that are happening in the United States, in Europe, in Asia, the Middle East, Africa, around the world. And those are that governments are looking to take more control of the care of their people. Rather than allowing it to happen in other countries or through other means, they want to create government systems to help keep their populations healthy. There's also a change in reimbursement models. Rather than just reimbursing a diagnosis or a procedure, there's more focus on reimbursing value and outcomes. And then there's also a convergence, or I would say an enhancement of healthcare with tech, and how we can blend tech into healthcare in order to deliver it better, much as Dr. Biden was referring to in the last question. And with all of this happening, it's creating more and more private and public partnerships between governments and private healthcare entities. The other issue that the other challenge that healthcare has had to deal with over the last number of years, and will likely have to continue to deal with it going forward, is a gap in talent. Not just people interested, but people skilled and trained in the many, many areas of healthcare to staff our clinics, staff our hospitals, to design the protocols Dr. Biden was recommending, to develop the digital platforms to give it to the people who need it and can make the greatest impact. And essentially blending the human touch with the technology. And then, of course, throughout the planet, there are population dynamics. We have an aging population. We're seeing more and more lifestyle or non-communicable related diseases that are occurring as diets change and behaviors change around the planet. We do have a lower mortality, but we need incentives in order to drive public health to continue that preventive focus rather than just treating the sick. And then we also know, as you've mentioned earlier, we have a number of broken, siloed healthcare systems. And we need to continue to break down the silos to have integration, not only within the different areas of healthcare, but how healthcare can integrate with the tech industry, with the governments, with public health, so that we really are serving the patients. So with a list of all of those challenges, the opportunities are huge. And the opportunities are for those who are willing to fill the gaps. And we're trying very hard at Mayo Clinic to make sure that healthcare and people who understand healthcare education, research, and practice are actually partnering with all of those entities, the governments, the tech, public health, and we are helping drive the future in redesigning healthcare to meet the needs of what people will need 5 years from now, 10 years from now, and 100 years from now. Dr. Biden, the opportunities are large. Anything else you want to add on how we can drive those opportunities?
Yeah, I think that was extremely well said. A few points that I would, further emphasize. One, I think you're exactly correct on the technology issue. I help lead our robotic neurosurgery program, and it's amazing when you walk into an OR today versus even 3 years ago. Almost think of your car today from your car 10 years ago, how much more technology, how much more innovation is in that vehicle today. That's what's happening in our operating rooms. And we see that every day occurring with robotics, with data, with the use of data, with how we use data, how it's utilized, our ability to track across campuses, to see what's happening in a variety of medical practices. I would also add the employer-based model, and Dr. Rizet alluded to this, which is there's a direct model. There's a desire to work directly, and so employers want to work directly with hospitals and medical groups and physicians. Governments want to work directly with hospitals, medical groups, physicians. We see that happening worldwide. And then finally, the interconnectedness of the world. And medical students often ask me, how do I decide what specialty? And Dr. Rizzo will be pleased to know I often use ID as an example. I say, if you want to help a few hundred people a year, you can do what I do. If you want to help millions of people, you can do infectious disease. And sure enough, we're seeing that today with coronavirus, unfortunately, and with its impact. But the world is so interconnected. When you look at, SARS-CoV-1, you largely contained geographically, MERS largely contained geographically. And then you look at SARS-CoV-2 and look at how uncontained it is geographically. And as soon as you hear of a variant somewhere, within days, there's another one there, there's another one there, there's another one there. And before you know it, widespread throughout the world. And maybe the African continent is less interconnected than what's happened with Asia and the Americas and Europe, but that's changing too. And I almost wonder if what we saw with Ebola, where you had a disease that largely could have been contained, if maybe that's the last that we'll see of that. Maybe in the future, we just won't see that kind of containment effort occurring in any successful way. Dr. Rizza is really the best person to comment on that. But I think the interconnectedness raises new opportunities, but also new challenges.
No, thank you very much. And again, I've been writing my notes here, and you're touching on so many issues that we see. I mean, it's not going to be business as usual going forward. There's so much happening. Healthcare is evolving quickly. You've got the technology component and how you can bring technology into the systems to enable this better coordination of care, if I can call it that. You've also touched on the data issue as well, and how do we overcome the multiple silos of data and then use data effectively. And again, it sounds like within Mayo, that's something you're able to do because you're thinking it from a system perspective. Also, I like the touch on the behavior shifts as well. The driving of value. I mean, we're beginning to see that in many of our markets, and that comes back to my point. It can't be business as usual. We need to move towards proactive healthcare and not necessarily always reactive healthcare as well. And also, how can the private sector support the public sector? And in many markets, and COVID has highlighted, there are still elements of dysfunctionality. How can the public sector make improvements, but also how the private sector can help support those improvements? So I don't know if either of you have any last closing thoughts that you would like to add to the conversation. Maybe Dr. Rizza, I'll ask you to go first. Apologies, sure. I put you on the spot.
No worries. Again, thank you for allowing Mayo Clinic and myself and Dr. Biden to be a part of this discussion, because clearly it's something that both of us and Mayo feel passionately about, that healthcare should be a right for every human on the planet. There are many reasons why that can't happen right now or hasn't happened, but we need to approach it thoughtfully and methodically and do it in a way that's going to best serve the patient, drive the science forward, and maintain the workforce to care for people going forward. And we strongly believe an integrated system, as we have done at Mayo, and as you've alluded to, Charles, in many of your comments, is the answer. To do it with partnerships, to do it with a vision to the future on where data is going, where knowledge and healthcare is going, and how we will serve people in their lives in the future, is the way we are approaching it, and we believe is at least a good step in the right direction to taking care of people long term. Dr. Biden, any additional thoughts?
I would echo many of those comments. Thank you, Charles, for having us. It's been great to be with you. And in 10 years, healthcare will look different than it does today. It'll be an exciting journey to see as those incremental changes are occurring to a new and hopefully better healthcare system. Many things are changing. Many advancements are occurring at a rapid rate. Nobody could have thought that we'd have a vaccine this quickly. Nobody could have thought that we'd have treatments this quickly. So the pace of change has become so rapid. I think the next several years will be very exciting as we see healthcare continue to evolve and grow.
Thank you so much. Dr. Rizza and Dr. Biden, thank you again. This has been absolutely fascinating, and we probably could have carried on talking for much longer. There are so many lessons to be shared from the excellent work that Mayo is doing, and that can benefit private and public sector initiatives in multiple countries. My quick summary, I mean, it is possible to build integrated healthcare systems, but it does require commitment and coordination. And when done correctly, it benefits the patient, but it also helps healthcare professionals and also those paying for the services as well, because it helps to drive value. And I want to pick up on the point that was made about, and it also helps to get better outcomes as well. But a system thinking does align clinical teams, it can drive multidisciplinary team thinking, and which ultimately allows the highest standards to be adhered to, which ultimately benefits the patient. So to you, the audience, again, thank you. And I hope you can join us for our final webisode where we're going to be discussing innovation. So thank you very much.
Thank you.